Hey, this is Dr. Berg. Today we're going to talk about the shoulder joint and how to make it very flexible. One of the challenges with having shoulder pain is that it holds a lot of stuck energy and it keeps your neck and traps very, very tight. A lot of people have that. I'm going to show you some great stretches to make your shoulders very symmetrical and very, very loose and less stressful. But the way I'm going to do it is very counterintuitive, and it's not taught in schools. So this is something I just learned from doing it on thousands of patients. So I think you can use these techniques. Now it does help to have someone else do this on you. You can sort of do it yourself, so we'll just have to adapt. If you have someone around the house, you can have them do this. But I want you to get the principle of how this works. So the first thing we're going to do is we're just going to check the range of motion on the shoulder. And there's a lot of different motions that we can test. The first thing we're going to do is we're going to check the internal and external rotation. So we're just going to take her arm and we're just going to kind of go down this way. Okay, we're going to internally rotate this way. And if you notice, the shoulder goes forward like here. So that's not good. So let's check this side here. You see how this one moves nicely? So she can go all the way down this way. Look at that, all the way. And you can probably even do this on the floor with your arms down to compare left or right. So we want to check first down this way and this way. So you just have someone take this arm out like this and you just rotate it and see which one is restricted. So we're not looking for weak muscles, we're looking for tight muscles, which are basically short muscles. All right, so now if the shoulder is not moving this way, the way we're going to stretch it is the opposite way. Now this is different, because if I keep stretching like this, it's just going to be like a rubber band. The way the muscles work is anytime you move a muscle, go ahead and just like do this. Okay. When she's moving this muscle, when she goes up, this is contracting. Okay. In order for this to contract and move, this one has to relax at the same time. So when she triggers this one on, this one automatically turns on. So they're on the same circuitry. On switch, off switch. Okay? So then when she pulls it out, she's contracting this muscle and this one's turning off. So anytime we have a muscle that is constantly in a state of tightness or contraction, it's on. So we can either stimulate the opposite muscle with pressure, or we can actually stretch the opposite muscle. Okay, so now if this muscle's not going down this way, we're going to be stretching the opposite way this way. So I'm going to stretch all the way here and then relax. Stretch for a second, relax. So all I'm doing is stretching in the opposite direction, that's all. So if I do this for about 10 times, stretching really good, she's going to start being able to stretch down here much better. See how that works? Okay. Now the next range of motion we're going to check, and I just want to first do the range of motion. So we're going to check going back this way. Okay. And going back this way. And this one seems to go back nicer. This side is contracted. Now she lays on her back. So we can actually take the arm right here and then go back this way and right here and just see how far this one goes back, and then this one right here. So I mean, we're just talking about subtleties, but if you lay in your back and this arm only goes down this far, we know there's a problem with this shoulder. So if that problem, let's have you sit up again, face the camera. So if this shoulder doesn't go back, okay, then we'll stretch the opposite way, going inward this way. So we'll stretch it, stretch it, stretch it, stretch it, stretch it. And it's nice to have someone do this on you. And then it's going to go back further and further and further. Okay? So in other words, you just put the person in the range of motion and then stretch the opposite way. So the next thing we want to do is we want to take the arm out here and just kind of raise it up as high as she can go this way right here. And then we're going to compare this way. You see that? So what's happening on the right side, it doesn't want to go up because this muscle down here is too tight. Okay? So what we're going to have to do is we're going to have to stretch the opposite muscle. Okay? So it's kind of like you have to think backwards. So what is the motion? The problem is when we stretch down this way, her body is in the way. We can't go further than this, and we can't chop off the body. So what we're going to do is that she's going to grab her arm on the opposite side. Just grab your wrist there, like right here. Yeah. So we're going to grab this, and she's going to pull this down. Yes. And she's going to, you can lean this way here, and you're going to stretch this right here. And so what she's doing is she's doing this right here. We're stretching this one. So we're stretching all these muscles here, which basically will allow her arm to go all the way up. Okay? All right, so we'll just do that's just showing you the opposite. Now, the other thing we want to do is we want to take her elbow right here and bring it inward. Okay? Good. Now let's compare it with the other side. Which one is tighter?
The right.
Okay. So with this one, we're simply going to do the opposite way, going this way right here. Now, if she's going tight right here, that means all the rotator cuffs back here are tight, so we want to stretch the front part of the muscle. And I'm not going to tell you the muscles and confuse you, but just all these muscles are tight. So she could even go in a door, like right here, and then stretch these muscles back. Okay, or I can just take her arm and stretch back this way. Relax. Stretch here. Relax. Stretch here. Relax. Stretch here. Okay, so that would be how to go forward. Now the other one is we're going to go backwards. So we're going to just bring your arm back this way. And let's bring this one right here. Which one's tighter?
The right.
The right one's tighter.
Yeah.
Okay, so then we're going to stretch the opposite. Let's bring your elbow, bring your hand, grab your elbow, and then pull it forward. 1, 2, 3. So that's what we're going to stretch the opposite. Okay? So we're just going through all the range of motion. Now the next thing we want to do, since the shoulder is connected to the back, we want to tuck the head forward and slouch right down. You feel any tightness in your upper back?
Yeah.
Okay. Now go back this way. Arch back. Is that easier?
Yes.
Okay. So what she'll do is she's going to actually do extension stretches. She's going to stretch back this way. And if you have a ball or something you can do this on, this is good. Stretch back, back, back. And that's going to allow her to go forward.
Yeah,
You see?
easier.
See how I did that? Okay. Now the other thing that I want to do is I'm going to have you scoot around with your feet over here facing, yes, right here. Okay, so now you got two bones right here called the scapula bones, and they connect to all these muscles here called the rotator cuffs, which rotate this. So the first thing we're going to do is we're going to shrug the shoulder on the right. Good. Now shrug it on the left. Which one's easier?
The left.
The left one is easier. So this one doesn't want to go high. So guess what she's going to do? She's going to push it down. 1, 2, 3, 4. And you could do it, have someone do it manually too, and really stretch that, because this scapula creates a lot of tension in these muscles right through here. Okay, so now we went upward. Now we're going to actually just take it and go forward. We're going to push it forward and bring this forward. I guess what you could do is you can take your arm, go forward this way, right here. Yeah. Okay. And then bring the other one. Yeah. You see how you're stretching these, it's called rhomboids. You're stretching these. Yeah, right there. So which one's tighter when you go forward?
The right.
The right one is tighter again. See, what happens is that this bone is moving on the ribs right through here. We want to see if there's any restrictions. So if it's tight going this way, what we're going to do is we're going to have her take this and keep it straight. Keep your arm straight and relax your shoulder. Arm straight. So we're going to stretch it back, back, back. Just do the opposite motion. Okay? Okay, so then the other thing is that let's bring the shoulder inward. Yes, right there. Okay. Now bring this one inward. Is that tighter? Which one's tighter?
The right.
The right one's, okay. So with that one, we're going to actually go outward. We'll stretch out this way. Okay, see how easy this is? We just find the motion that's tight and we do the opposite. And the last one is you're going to shrug this down. Okay, and then shrug this down. Okay, shrug this down. Which one's tighter?
The right.
Of course. So we would just stretch it up. Okay, stretch it up. Now there is a common denominator to what I'm finding here. Every single range of motion on the right side is tighter than the left. If this happens, then we know there's something else going on. And that means that this shoulder is being caused by something referred by somewhere else. Now, she did tell me, right before I did this video, that she, when you were how old?
13.
13, dove off of in a pool and hit her head, right?
Mm-hmm.
And compressed the head and fractured these bones right here. She has a plate in her neck. And I'm thinking, okay, that could have caused this, but there was no nerve damage. Of course, a compression injury, we want to do traction, of course, right? But there's something else that can cause a right shoulder pain, and it's the gallbladder. So I'm going to try something. I'm going to try an experiment here. I don't know if it's going to work. Don't try this at home. No, I'm just kidding. Lay right on your back, face up. So the gallbladder is right here, and all I'm going to do is just kind of press a little bit in here and massage the gallbladder a little bit within her tolerance right through here. Now what I'm going to do is I'm going to kind of work on this for a couple of minutes, and then we're going to see if this is connected to the shoulder. I would say 90% of people with right shoulder have a gallbladder problem. And again, if that's the case, all the stretching in the world is not going to work because this is the culprit. Now, what is the relationship between this gallbladder and the right shoulder? There's a nerve that comes right through here, all the way up into the right shoulder. So, and that would be called the phrenic nerve. You actually have one on the opposite side too, but if it's on the left side, it could be the pancreas. Now that tendon right through there.
Mm-hmm.
So we're just kind of coming in there and kind of working it out a little bit. Okay, now what I'll be curious about is let's just see what her shoulder does now. Okay, bend this right here. Okay, relax your shoulder. Look at that. Full range of motion. Goes all the way back. Does it feel looser?
Mm-hmm. It does
Yeah.
feel looser.
Okay, so guess what? Okay, raise this up. Okay, so here's the shortcut. If you see all the restriction on the right side, not just one motion, you're going to have to work on the area on the gallbladder to really free it up. That was her problem. And then the next question would be, what is she eating? Because a lot of junk food, rich junk food, sugars, alcohol, all this stuff can aggravate the gallbladder and cause this. So is there anything that you've eaten that borderlines on not healthy?
Yeah, sometimes, yes.
Okay, I like that. Sometimes. So we'll cover that after we turn the video off. But yeah, so you just have to clean up the diet if you want to keep the shoulder better. Also, a lot of nuts will do it too. Okay, so that's just some tips on shoulder range of motion, and go ahead and apply some of these stretches, and it's going to take a lot of stress out of your shoulder.